Welcome, friends. This is the Revitalizing Life Health Talk. I am Jenny from Hughes Healing. I am a healing facilitator, and I will talk more about what that means in the presentation tonight. So let me get the slideshow going. Do a share. Right. I got into healing facilitation about 5 years ago, and I have learned an amazing amount of information about the body, about neurology, about health and wellness and personal development and how it's all connected. And this talk is my complimentary way of sharing some valuable information that I think people can use and to educate about how important healing is. I think to some people it sounds kind of woo-woo, but it's actually really based in the science of neurology, and we see some amazing results with people. So let's dive in. Tonight, we're going to talk about the difference between healing and curing. Sometimes those words are used interchangeably, but they're actually very different. We're going to talk about what is healing facilitation. What does that mean? Why your posture matters a lot. How you can reclaim some of your vital life energy. You know, you see little kids running around, they're just so free and full of energy. Like, what happened to that? For us, we could use some, right? And we're also going to talk about some benefits that you should expect from any kind of healing care that you are receiving. All right, so curing versus healing. A cure is basically a treatment to make some symptoms go away. Some examples would be taking some antibiotics or having some surgery to remove a clog or something that isn't going well. And I am not one who's going to tell you to stay away from doctors. In fact, I believe you should have a really good relationship with your doctor, and healing practices are very complementary. The medical field, thank goodness they have the medical wizardry that they have when you have something acute going on. You know, maybe you're in a car accident, you're all busted up, or you have some type of infection that needs to be treated. That has its time and place. Now, healing honors the built-in or the innate intelligence that your body has. It's more about a journey of discovery for yourself, a personal journey. And you are really the hero of that journey. A healing facilitator like me is really just a guide to help you find the places to look. Healing is about moving forward in life, where curing is kind of about going back in time, if you think about it. If you are experiencing some symptoms and you go to the doctor to seek a cure, basically you're asking for the symptoms to be removed so you can go back to the way you were before and carry on with your life the way that you were carrying on. Now, I want to make a note here that cures can lead to healing, and healing can lead to cures. Now, just to put it out there, I am not licensed to diagnose and treat any illnesses. I am a healing facilitator guide, and I expect my clients to take full responsibility for their health. Now, an example of a cure leading to a healing, this is kind of an extreme example, but if somebody has to go in for heart bypass surgery and the doctors have to crack open their chest to do that surgery, and they come out of it a more loving, open, compassionate person, that would be an example of a healing that has taken place as a result of that cure. Now, an example of where healing facilitation can lead to a cure. When I started at receiving healing facilitation over at Graceful Health in Newcastle, I was struggling with some uncomfortable issues. And the interesting thing is they did not focus on those issues. Basically, there is a focus on what's working and expanding the wellness, expanding what's working. And we'll talk more about that in a little bit here. All right, so the basic concepts of healing facilitation are your body has built-in intelligence for making repairs. I think all of us have, cut a finger and watched over a bit of time as the cut heals itself. You might use a Band-Aid to cover it up and keep it clean, but the body is taking care of that repair, right? Now, in healing facilitation, symptoms have meaning. The idea is that your body is trying to tell you something that you need to do differently. And that's why healing is really a journey of discovery, of getting to know yourself better and possibly making some changes that are going to serve your life better. Now, another concept is that stress and excess tension really get in the way of healing. And that is because in our nervous system, we have two major operating modes in the nervous system. On the one hand, you've got the sympathetic sympathetic nervous system. When you're in the sympathetics, that's basically stress response. You have detected some kind of threat and your body goes into survival mode. And in that case, blood flow is directed away from the organs, away from the prefrontal cortex, and out to the extremities to make it easier for you to fight or to run, to get out of there. And so it's not a time that your body is in the rest, digest, rejuvenate, which is the parasympathetic nervous system. So in healing facilitation, we want to have a focus of dialing down those sympathetics and dialing up the parasympathetics. The feeling of making progress is a basic human need, is what I've learned. And as Tony Robbins says, the key to happiness is progress. And with healing, people need human touch. And that's one of the beautiful things about healing facilitation is just gentle, loving care. We use light contacts to the tissues surrounding the spine. We have a broken healthcare system. So despite what I said about the medical field having all their wizardry, and I'm super grateful for that, there have been times when I've needed it and family members have needed it. At the same time, it's broken. And what we really have is illness care. When you go to a medical doctor or to a hospital, they are focusing in on some issue. So I like to think of healing facilitation as healthcare, and going to the medical system is really more of illness care. And there are some sad statistics out there that life expectancy has been dropping since 2014. That comes from CNN. The US ranks 5th in cancer deaths. I mean, isn't that kind of shocking? Because we think of ourselves as this developed country. You'd think that we would be in the higher or, the lower end of deaths happening from an illness. But in 2021, we ranked 5th. And there is some research showing that it tends to be more prevalent in that cancer tends to be more prevalent in high income countries due to lifestyle factors. Now, here's an interesting one. Taking the correct drug for the correct diagnosis kills hundreds of thousands of people per year. So this is when the doctor has prescribed the right drug, the patient has taken the correct drug and the correct dose, or the nurse has administered it the correct drug and the correct, everything was dispensed as it was supposed to be. Still, people can die from reactions to medications. And that statistics comes from the Journal of American Medical Association, reporting it as the 4th leading cause of death in the US back in 1998. And over-the-counter medicines are not as safe as we are led to believe. I want to take a specific example here next. I really think we need a new mindset about OTC medications. I think we're led to believe that just because it's over the counter and doesn't need a prescription, that it's safe for us to take. And one example is the painkillers like Advil and Motrin. These are non-steroidal anti-inflammatory drugs called NSAIDs for short. And what they actually do is they inhibit platelet aggregation. So that means that there's bleeding because there's not proper clotting going on. They also block a certain body chemical that normally dilates the blood vessels leading to the kidneys. Therefore, the blood flow to the kidneys is decreased, and that means a lack of oxygen getting to the kidneys, and that causes acute kidney injury. I have a close family member who a few years ago was diagnosed with a large tumor on his kidney. It was about the size of an egg. And in that whole process of getting diagnosed and figuring out what to do and how can we avoid dialysis, and some big decisions had to be made, what came out was that he had been just popping an Advil once a day for about 10 years. He's an active guy. He likes to get out and play tennis, and he was just managing some aches and pains by taking an Advil a day. So that's one thing that if you don't take anything else away from this talk, I like to give an example of, maybe think twice about these medications, even if they're over the counter. The New England Journal of Medicine in 1999 said that non-steroidal anti-inflammatory drugs for rheumatoid and or osteoarthritis conservatively cause 16,500 Americans to bleed to death, making it the 15th leading cause of death in the US. So these are some serious numbers that I like to bring to light. All right, so why am I doing this work? Why is healing needed? This graph is basically a timeline that your biology reflects your biography. So what happens, we're little kids and we're happy-go-lucky and we can roll around on the floor and run around. We have all kinds of energy. And over time, we have experiences, and some of them are really good. Some of them are not so good. And the not so good ones, which are represented by the red down arrow here, those are stressful events that tend to load up tension into our bodies. Our bodies have this mechanism of stuffing. And so what happens is we load up tension in the body, and that tension disrupts the optimal functioning of the body. It leads to what we call this stress physiology, defensive posture. That's why you see some older people around town are really hunched over. That's a defensive posture that has slowly happened over time as they're unconsciously trying to protect themselves from the big and little traumas that we experience in life. And this is really what leads to dis-ease if we don't have a way to dissipate this tension. And it's a very vicious cycle because Our brains are hardwired to focus on the negative. We are prey animals. And what you focus on, you get more of. That's the law of attraction. So this is kind of a vicious cycle. And we need tools for breaking that cycle and releasing the buildup of tension in our nervous system. We're going to do a little experiment right now. So I want you to take like a defensive, depressed kind of posture where you're going to hunch over, look at the floor, you know, your shoulders are in, you're just kind of protecting your organs. Now, I want to ask you, can you feel inspired in this position? How do you feel? It's a little bit challenging, isn't it? So next, let's do an epic stance where you've got your arms up in a V, you're looking up, you're welcoming the world. You could even stand up and have your legs in a strong posture. Now from this position, how do you feel? Can you feel depressed in this position? I don't know about you, but I feel much more inspired in that position. So this is just an example of how posture matters. Let's talk a little bit more about this idea of stuffing it. That's really the drain on your vitality. So our bodies somaticize trauma to protect us. And just so you know, the word soma is Latin for body. The data files are stored for processing later. What that means is that a lot of traumatic things that happen to us that we can't process cognitively with our brains, a lot of this happens in childhood. Our body just has this strategy of like, oh, I'm going to stuff this away until it can be dealt with later. So it's a great short-term strategy because the brain doesn't have to focus on all the bad things that have happened. Those data files are stored away because otherwise you'd be really overwhelmed with all of this unprocessed trauma. So it's a good short term, but it's bad in the long term because your vital energy is being used to lock up this information. It physically locks up in your body and creates bound energy. It's basically being wasted on old data. So this excess tension, it compromises your neurological pathways, the pathways that are going between your brain and your nervous system. It's the brain-body communication. And the more tension there is, the more that communication is compromised. So there's this question out there, are spinal misalignments related to dis-ease? And there was a Dr. Henry Windsor who was asking this question, and he performed a study at the University of Pennsylvania. And what he did was he was able to take a look at 97 cadavers. They studied a total of 221 disease organs to see if there was a correlation between issues going on with organs and where the nerves that go out to those organs connect into the spine. And there was a nearly 100% correlation between minor misalignments of the spine and these diseases of the internal organs. So the Medical Times reported the evidences of the association in dissected cadavers of visceral disease, visceral is like the organs, with vertebral deformities of the same sympathetic segment. So we're going to look at it. I like visuals, so we're going to take a look at this here. So Windsor findings with heart disease, all 20 cases of the cadavers having a heart condition had the upper 5 thoracic vertebrae were misaligned. So let's take a look. I gotta move my video out of the way. So here's the heart, and you can see the nerves coming out from the upper thoracic area of the spine. Stomach disease, all 9 cases of stomach disease had spinal misalignments in the mid-thoracic. So same thing, stomach is here. Here are these nerves going to the mid-thoracic. Oops, I just did it. So same thing, liver disease, all 13 cases of liver disease had misalignments in the mid-thoracic area from T5 to T9, and kidney, all 17 cases with kidney disease were out of alignment in the lower thoracic area from T10 to T12. I would say that's pretty compelling evidence for the connection between spinal misalignments and the root cause of dis-ease. So in the healing facilitation that I have been trained in, it's called Elan Healing. We believe the root cause of disease is adverse mechanical cord tension. So the spinal cord and the brain, we know that these are the most important part of the body because they're fully encased in bone. The brain is encased in the skull and the spinal cord is encased in the spine. And what happens when you have spinal misalignments is the spinal cord is either getting stretched, so you can see in the diagram on the left, if you just have a simple like defensive posture where your head is moving forward of your spine, it's not being supported in the way that it was designed to be supported, where there's a 12-pound load on the spine. Now with a defensive posture, your head starts to move forward and the resulting weight or stress on the spine is increasing depending on how far forward the head is cantilevered out. So that causes a stretch. And if you think of the spinal cord as like a hose, you realize that if you stretch it, the diameter of that communication channel is going to get smaller, and that's going to compromise the communication. Now, what also happens is a twisting of the spinal cord, and that happens when there are tensions held in the body that are holding the vertebrae out of alignment. So you create this twisting action that also compromises the communication between the body and the brain. And this is the root of disease. And then it's a vicious cycle because the tensions in the body cause misalignments of the spine. They put force on the spinal cord and the brain stem. That causes the body to be in more stress response, in chronic stress response. And then there's no time for the healing really to take place. So the primary goal of the healing facilitation work that I do is to facilitate the body being able to reduce that adverse mechanical cord tension. Okay. Benefits of healing care. These are the benefits that, whatever modality you're looking into or utilizing, you want to make sure of these things, that you're expanding ease in the system. You're focusing on what's working. We call it wellness care. And that's because of law of attraction. What you focus on expands. So doesn't it make sense to focus on what is working? You want to dial down the sympathetic nervous system while dialing up the parasympathetic nervous system. So that's dialing down stress response and getting more of that parasympathetic rest, relax, digest, heal. It benefits you cognitively too, because when there's more blood flow going to the cortex, instead of just being diverted to the hindbrain for survival, you have access to more executive planning functions, to creativity, even to intuition. Your body has a lot of wisdom. And when you get into the more relaxed state, you have more access to that. We want to optimize the neurological tone. What this means is your body is like an instrument, and it sends out its music into the world, and depending on what that music is, attracts back to you, what is being put out there. So if you get these misalignments, or you're in stress response, you've got defensive posture, and your body's tone is kind of off, and then the things that are coming back to you in life are kind of off. This is an idea that my teachers learned from Donald Epstein, who's the author of the 12 Stages of Healing, that the shape, tone, and tension of your spine determines the shape, tone, and tension of your life. This was a big, mind-blowing concept for me. Whoa, shape, tone, and tension of my body is reflected out in the shape, tone, and tension of my life. Healing care should also increase the coordination and balance that you have. And this has to do with the cerebellum. And that's one of the reasons that Elan Healing is so powerful, is that we are using the neurology of light touch to activate the midbrain to check in with certain areas of the body and make adjustments if needed. And so what we see with practice members is an increase in coordination and balance. And like I talked about before, this work tends to naturally help people make healthier decisions and be able to access their inner knowing. Okay, one of my lovely practice members gave me permission to share her beautiful results. And there's a few things that I want you to notice about these before, when she started, and then 6 months later. The first thing that I think is most striking is just her countenance. She was kind of hiding and unhappy when she came to see me. And then, 6 months later, she's kind of this glowing person. And her body, if you notice, I put a line underneath her hands so that you can see that, one hand used to be kind of lower than the other, and now they've evened out a bit. There's increased symmetry. From the side view, you could see at the beginning that she had a somewhat unhealthy looking lumbar curve going on there in her spine. And just with the neurology of light touch, that corrected itself. So she's got a healthier lower back position. Her head has come back over into more of the supportive place it's supposed to be, taking pressure off of her spinal cord. And she lost 35 pounds in this time frame. So people will ask me, well, what makes Elan Healing so powerful? And I've kind of distilled this down to 3 big things. The first one is philosophy. We focus on what's working. We want to use that law of attraction. What you focus on expands. So we're looking for areas of ease in the body to work with and expand. We honor the body's ability to heal. We never think that we are smarter than the body. We honor that the body has to go through its own reorganization. Secondly, the neurology of light touch. I touched on this earlier, with the use of sensory receptors in the skin. You have an astonishing number of receptors in your skin that are just waiting to detect light touch and vibration. And they're essential for exploring your environment, for social interaction, and for the sense of touch. And what happens is there is specific tuning by the midbrain that happens when we are making light contacts on your skin. This leads to improved mind-body communication and a better ability to heal. So number 3, your life is a reflection of what's inside. We don't see the world as it is. We see it as we are. Famous quote from Anais Nin. And that goes back to the shape, tone, and tension of your physiology is reflected out in the shape, tone, and tension of your life. My teachers have been collecting data on this work, thank goodness. And the practitioners that have come out of their training program have continued to collect data. The data looks incredible. And what it shows us is over 20 years of taking data, that in the first 2 months of Elan care, on average, physical comfort in the body increases by an average of 14.5%. That's huge, for people that are having aches and pains or whatever going on. Mental and emotional states improve by 21.4% on average. And just to give you a comparison, generally, when you take any of the mood altering drugs for anxiety or depression, there's usually about a 1% improvement. Whereas with this work, we're seeing the 21.4%. And I want to point out here that anxiety is really rooted in what's going on in the body. I mean, we think about anxiety as being the stuff outside of us, but really anxiety is coming from feelings of lack in your body, like not getting enough oxygen. If you're having shallow breathing, there's a lack of oxygen. If you're in stress response all the time, then there's not enough blood flow going to the organs and to the cortex. So that's like the hidden cause of anxiety. I did one of my newsletters on this. And that's why the mental emotional piece is so relevant in this work. On average, stress levels drop by 21.7%. Enjoyment of life goes up by over 10%. And on average, quality of life ratings increase an average of 18.2%. If you know a modality that gets better results than this, please tell me. I mean, I love studying different modalities for improving life and, creating more wellness. All right, so let's review. We talked about the difference between curing and healing, where curing is like a treatment, it's going back in time. We want to get that treatment to make that symptom go away so we can go back to how we were. Whereas healing is a journey of self-discovery, and it's nice to have a guide on that journey. Illness care versus wellness care. Focusing on the wellness really makes more sense to me in terms of law of attraction. We want to grow wellness. We don't want to grow illness, right? There are safety issues with over-the-counter medications. So I'm not going to sit here and say that I never take them. Sometimes it's really helpful, but you want to be careful about taking them on a regular basis. So stuffing it, the body's strategy for somaticizing is what is using up your vital energy all the time. And what people find with this work is that some of that bound energy gets released, and then it can be applied to other things in your life to make your life better. Our top priority in Elan Healing is to reduce that spinal cord tension, the adverse mechanical cord tension. I shared some beautiful results from my lovely practice member, and basically a focus on ease, on what is working. We want more of that. Good nutrition and exercise are important, but spine health is really primary. I mean, you can be eating a perfect diet and exercising a ton, but if you're carrying that excess tension and running around in chronic stress response, you are still going to be creating dis-ease. in your body. All right, I always like to end with an invitation to action. What is next for you? The easiest thing, I think, is to do a complimentary initial consultation. Sometimes I call this a clarity session because we just get more clarity on where you are, what are you looking for, what would you like to see happen in your life? And I think it's helpful just to have that kind of conversation with someone, even if you don't end up coming into care for me or with me, or you have something else in mind that's going to serve you better. So what I like to offer is you schedule the consultation tonight and you receive the physical assessment that I do complimentary as well. And that's a $75 value. People always ask about the sessions. I block out about 30 minutes for them, and each visit is $39. There are packages available. Maybe you want to attend an upcoming class. I teach what's called evolutionary personal care. It's a part of the Hughes Healing work that a person can do with themselves. So I teach you how to do that, and it's simple. It's things you can do in just a few minutes a day that help you move forward on your healing journey. So I have a class that I teach about once a month on that. If you don't see it on my Eventbrite, I may have gotten behind on posting my next class. Just reach out to me and be like, hey, I want to take that class. I think I also have a recorded one available on my website. Sometimes I've called it the meditation for overthinkers, which is kind of what it is too. Okay, so it's easy to work with me. It's easy to reach out and connect with me. My cell phone is 530-389-4141. And of course, you can find me at jennyhugheshealing.com. So thank you for your attention. I hope you got something valuable out of this, and I hope to connect with you soon.